Welcome to Indian Healthcare BPO channel. Indian Healthcare BPO providing training for medical coding, medical billing, pharmacovigilance and clinical research. For further detail, contact the given number here. So I'm going to talk about the parathyroid gland physiology and the diseases. First, I will talk about the physiological anatomy of a parathyroid gland. Normally, humans have four parathyroid glands which are located behind the thyroid glands, one behind each of the upper pole and each of the lower pole. The parathyroid gland contains mainly of chief cells which produce parathyroid hormones. Parathyroid produce Parathyroid hormones provide a mechanism of controlling the calcium and phosphate concentration by regulating the intestinal reabsorption and renal excretion. Then, the effect of parathyroid hormones on calcium and phosphate concentration. On the effect of parathyroid hormone to increase calcium and phosphate reabsorption from the bones, and a rapid effect of parathyroid hormone to decrease the excretion of the calcium by the kidneys. And third, the decline in phosphate concentration is caused by the strong effect of parathyroid hormones to increase renal phosphate excretion, and an effect that is usually great enough to override increased phosphate absorption from the bones. In this diagram, you can see like a parathyroid hormones act on the bone and releases calcium, and act on the kidney and reduces calcium clearance and vitamin D activation, and in intestine activated vitamin D helps to reabsorb calcium in the guts. And the parathyroid hormones mobilize calcium and phosphate from the bones. Parathyroid hormones has two effects to mobilize calcium and phosphate from the bones. First, one is rapid phase that begins in a minute and increases progressively for several hours. This phase results from activation of already existing bone cells, mainly the osteocytes, to promote calcium and phosphate release. The second phase is much slower one, requiring several days or even a week to become fully developed. It results from the proliferation of osteoclast followed by the greatly increased osteoclastic reabsorption of the bone itself, not merely release of the calcium phosphate salts of the bones. Then, control of parathyroid secretion by calcium ion concentration. Like even the slightest decrease in calcium ion concentration in the extracellular fluid cause the parathyroid gland to increase their rate of secretion within a minute. Then, a change in the extracellular fluid calcium ion concentration are detected by the calcium sensing receptor in the parathyroid cell membrane. If decreased calcium concentration persists, the gland will hypertrophy. For example, they also become greatly enlarged during the pregnancy and during lactation. Conversely, condition that increases the calcium ion concentration above the normal cause decreased activity and reduced size of parathyroid gland. Such conditions include excess quantity of calcium in the diet or increased vitamin D in the diet, and third, the bone reabsorption caused by the factor other than the PTH, that means the parathyroid hormones. So, the summary of effects of the parathyroid hormones. The main effect of increased PTH secretion in response to decreased extracellular fluid calcium concentration. First, the PTH stimulates bone reabsorption, causing the release of calcium ion into the extracellular fluid to increase the calcium concentration, right? Then the PTH increases reabsorption of calcium and decrease phosphate reabsorption by renal tubules, leading to decreased excretion of calcium and increased excretion of phosphate. Third, the PTH is necessary for conversion of 25 hydroxycholecalciferol to 25 125 dihydroxycholecalciferol, which in turn increases calcium absorption by the intestine. Okay, now the disease of parathyroid hormones. Hypoparathyroidism. When the parathyroid gland does not secrete sufficient PTH, that means parathyroid hormones, as a result, calcium release from the bone is so depressed that the level of the calcium in the body fluid decreases. When this low calcium level is reached, the usual sign is tetany that will develop among the muscles of the body, especially sensitive to tetanic spasm or the laryngeal muscles. Spasms of the muscles obstruct respiration, which is usual cause of the death in the person with tetany unless appropriate treatment is provided. Then the hyperparathyroidism. We have two types, primary hyperparathyroidism and secondary hyperparathyroidism. In primary hyperparathyroidism, an abnormality of parathyroid gland cause inappropriate excess PTH secretion. So the result will be hypercalcemia because of the hyperparathyroidism cause depression in CNS, that means central nervous system, muscle weakness, constipation, abdominal pain, and also peptic ulcer and lack of appetite and depressed relaxation of heart during the diastole and kidney stone. This all will be the result of hyperparathyroidism, which causes the hypercalcemia. The secondary hyperparathyroidism, there will be a high level of PTH occur as a compensation for hypocalcemia rather than as a primary abnormality of the parathyroid gland. In contrast to primary hyperparathyroidism is associated with hypercalcemia caused by vitamin D deficiency or chronic renal disease where there will be a damage in the kidney. So kidney cannot like unable to produce sufficient 125 dihydroxycalciferol. So there will be a hypocalcemia. So the PTH will be increased and which causes the hypercalcemia. Thank you. Thank you for watching the video. For further videos, subscribe the Indian Healthcare BPO channel.